Linda Belcher coming in for arterial fibrillation, no known allergies, date of birth 9/4/1972, Coumadin 5 milligram as taken by mouth daily for AFib, ordered by Dr. Who. Medication, we're checking warfarin, Coumadin, 5 milligrams, and then also the expiration date and lot number. Hi Linda, my name's Taylor. I'm going to be your nurse today. It looks like the doctor ordered some Coumadin for you. Have you taken this before? Yeah? Okay, so you know how it works. We're going to make sure that your INR, your PT INR stays within range of what the doctor wants, which is usually between 2 and 3. We're going to make sure that we recheck your blood in a few, see what your level's at. It can take a couple of days for this to start taking effect. So just when you're at home, make sure you're taking it as directed, following up with your PT and INR test, and then follow up with your primary care as well. Can you just verify your name and date of birth for me? All right, just gonna take a look at the bracelet. I'm gonna scan the medication, scan the bracelet. Medication's gonna be in the cup. Patient's gonna take it. And then also gonna inform her not to drink any alcohol, making sure to keep a same diet, not increasing any greens, so no increasing of salad, leafy green vegetables like spinach. And then we also want to make sure that she is using a soft toothbrush, flossing, as her gums may bleed. We're also going to document what time we gave it to her, what her lab stated when she had them done prior to getting the medication, which will involve the PT, INR, CBC, and then also making sure that we're documenting the input and output of her stool and urine, as they can have an inconsistency. First patient is Anna Kendrick. Her date of birth is 4/5/1980. She's allergic to penicillin and sulfa. She's been prescribed 500 milligrams to take by mouth daily, metformin for diabetes, ordered by Dr. Who, and then expiration date, medication 500, and she'll take this as soon as we go into the room. Hi, I'm Taylor. I'm going to be your nurse today. Are you Anna? Hi, Anna. So it looks like the doctor ordered some metformin for you for your diabetes. Have you taken this before? You have? Okay, perfect. So just make sure that you are aware that, or remember that you may have some nausea, vomiting, some diarrhea. Make sure that you follow the diet that the Dr. Who prescribed you. Exercising and limiting sugar intake, just so that your levels stay where it should. What was your blood glucose? Do you remember? No? Okay, I'll just look. Okay, so we're also going to monitor your liver enzymes. Make sure that your liver is still functioning how it should. And then, let me just get your wristband. Can you verify your name and date of birth? Perfect. Are you allergic to any medications? Penicillin and sulfa? Okay, perfect. So we'll go ahead and take this for me. Okay, and then we'll come back in and check on your blood sugar and see how you're doing. Just let us know if you start feeling any vomiting or nausea, and we'll give you some medication for that, okay? The next patient is Natalie, date of birth 4/20/1975, no known allergies, giving 5 units of regular insulin and 5 units of the NPH insulin to be given now subcutaneously for her diabetes. This was ordered by Dr. Who. We got the medications, the expiration dates are good. We're gonna draw up 0.5 of air in this, put it inside the vial, push it in, and then do the same thing for this. But before we do that, we'll sanitize the top of the bottle, because usually you'll have 2 of those. And then when we go into the room, we'll talk to the patient, ask them where they want the injection, either in the arm, the stomach, the thigh, and give them an option. And then it'll be together. So you'll take some of this and put it into clear fluid, cloudy fluid, and then that'll go into wherever they would like it. Hi, Natalie. My name's Taylor. I'm going to be your nurse today. So it looks like the doctor ordered some insulin for you for some diabetes. Do you usually take insulin? Yeah? Okay. So, with that, where do you usually want the injection? Do you want it in your stomach, your arm, your thigh, in your stomach? Okay. So, I already have it drawn up for you for one of them, and then I'll do the other. Or they're going to go together, actually. Okay. Can you just verify your name and date of birth for me? Any allergies? No known allergies? Okay. So with this, we're going to make sure that we're checking your blood glucose. And then we're going to be periodically checking that again, just to make sure your levels are coming down for your blood sugar. Just make sure that you let us know if you're getting any nausea, vomiting, feel like you're getting a little dizzy, your blood sugar may be too low. So we're gonna do an injection. This is gonna go in her stomach. You're going to go straight in because she is a heavier woman. It's gonna go like this. You're gonna go straight in, inject the medication. And then once you're done, you put it in a Sharps container and discharge. You will make sure that you wear gloves while you're doing this, as you may get blood on you from the injection site. It's a little harder to do this on a monkey, and I don't have a injection pad. Next patient is Joseph Smith. He's getting some insulin, depending on what his blood sugar's at, depends on how much he'll get. If it's between 200 and 250, he'll get 6 units of insulin. If it's 251 to 275, he'll get 8 units. If it's 276 to 300, he'll get 10 units. He has no known allergies. This was ordered by Dr. Who. If it's over 300, then we'll call the provider for some orders. And then the medication, expiration date, and then we'll sanitize the top of the bottle, draw up 0.5 of air, and then inject it straight down into the bottle, and then we'll pull out 0.5. Hi, Joseph, I'm Taylor. I'm gonna be your nurse today. It looks like Dr. Who ordered some insulin for you. What's your blood sugar at?
245.
245? Okay, so it looks like we're gonna do 6 units of insulin. So 100 units per ml. So if it's 200, we're gonna do about 0.6. So the air, 0.6. We're gonna draw it up. And then we're going to inject on a site that he would like. Which arm would you, or where would you like this at? Your arm, your stomach, or your thigh?
My arm, please.
Your arm? Okay, we can do that. So I'm gonna put on gloves. I'm gonna sanitize the back of your arm. And he's a heavier set guy, so we're gonna pinch the area and go straight in. Release, pull, and pull out. And this makes the medication move around and spread out. All right, Joseph, we'll come back in and check on you shortly and see where your sugar is at, okay? Next patient is Sheldon Cooper. Date of birth is 8/14/1990. He's coming in for diabetes. Dr. Who prescribed Lantus 10 units to give sub-Q every hour or every night. This is Lantus bottle, expiration date, 100 units. With 100 units per ml, we are going to do 0.1 ml to give him. Hi Sheldon, my name's Taylor. I'm going to be your nurse today. It looks like Dr. Who ordered 10 units of Lancet. Have you taken this before? You have? Okay. So it looks like this is going to be given subcutaneously, so in your arm, your stomach, or your thigh. Where would you like it put at? In your stomach? Okay. So Sheldon is a smaller person. He does not weigh as much. He is only 32. So with that, we will go in at a 45-degree angle to inject the medication. We'll sanitize the area. We'll also scan the medication and his armband, have him verify verbally his name and date of birth. And then we will give him the injection. It will go in at a 45-degree angle. And then put the needle that has been used in the sharps container. Gene Belcher, he is coming in for albuterol for asthma. He was prescribed albuterol inhaler. Pro Air is what we have on hand. Expiration date. He will take 1 puff of this, and we'll keep an eye on his oxygen. And then also if he's having any more difficulty breathing. Hi, Gene. My name's Taylor. I'm going to be your nurse today. Is this Mom with you? All right. Hi, Mom. So it looks like he's having some difficulty with asthma. Does he have history of this from exercising, running, family history of it? Okay. So has he ever used an inhaler before? All right. So with that, you will take it and you will put it next to your mouth. Do not put your mouth on it. And then you will take 1 puff in, hold it, and then exhale. You may get a headache from it, some insomnia, not wanting to sleep. You may also get some little jitteriness from it. That's just the albuterol. It's part of the medication. It's one of their side effects. Do you have any questions, Mom? What about for you, Gene? Okay, so I will give that to you. You'll take 1 puff. We'll document how he did. If he's having any reaction, check back in on him. We have Tina Belcher. Date of birth is 11/11/91. She's coming in for asthma. Dr. Who ordered some nebulizer treatment, which is albuterol. You have the cartridge here, expiration date. You'll take 1 of these and put it into this, and you'll fill it up. Do not put it in the middle as it can leak through. And then we'll connect that with this. And then that will connect to the machine, forcing oxygen through it. And we'll put that on the bottom of it. Hi Tina, my name's Taylor. I'm going to be your nurse today. It looks like Dr. Who ordered you some albuterol through a nebulizer. So this is going to help you breathe and get some of that stuff down in your lungs coming up, so you're having easier time breathing. So usually we have a different piece, one that has a mouthpiece, and you'll just breathe that in normally. This one is more so to wrap around your head, as it may be harder for you to breathe it in right now. I'm going to check your oxygen, see how you're doing, and then can you verify your name and date of birth for me? Perfect. I'm going to document. And it looks like your oxygen's at 92 right now, so we want it a little bit up more. So you may feel some jitteriness. That's part of the medication. You may get a headache. It may make you nauseous. It sometimes can. It just depends on the person. And then we'll come back in and check on you and see how you're doing and see if that's helping. Do you have any questions? No? Perfect.